Hello, my name is Ashley McCants. I'm an occupational therapy student at the University of Mary, and this video is going to be on medication safety for children. Please check out the rest of the videos on my channel for more parenting tips and tricks for kids. This YouTube Present Parenting will just kind of be a compilation of all of the presentations and gatherings I've made for my doctoral capstone project. So feel free to check those out and leave some comments if you have any questions or concerns, or feel free to email me as well. So we'll get started. Medication safety for children. So for this video, we will be going through medication safety, reading the label, measuring medication, giving medication, tracking medication, and common questions associated with medication. So first off, medication safety. So medications can be used for many things with infants and children, and they also can just be your own medications as well, or anyone that comes in your household. They might have medications in their purse, so it's always important to store medications safely. Use the medicine containers that they come in. Keep all original packaging and bottling so you know when that medication expires, and you can still read the medication properly as well. No medicine is childproof. So those caps that might be really hard to get off for even adults at times, they are not childproof. They might make it harder for your child to open, but just about any of them can be opened. Make sure you're storing medication out of reach and out of sight of children. Let anyone that visits know that they can't store their medication somewhere that's accessible. So if they do have it in a purse with them, please ask them to put it in their car or anywhere that the children cannot get to it. As you can see in this picture on the right, this mom is storing medication up and away. You can see that's not only just over the height of the child, but also out of sight as well. Even younger children, especially toddlers, they can get to things pretty easily. They'll start their problem-solving skills at about 2 years old. So that's when they'll start being able to understand that, oh, I can't reach the counter, but if I have a stool that I can stand on, that can reach the counter. So that is something to look out for when storing your medication. So on to section number 2, reading medication labels. So there's different types of medication. The two that are the big ones is over the counter. So these are medications that you can get at pharmacies, grocery stores, or even gas stations. You just buy them over the counter. Sometimes you do have to show an ID for certain ones depending on the ingredients, but most common ones are Tylenol and Advil that people buy over the counter. That comes from a pharmacy that has to be prescribed by a doctor, or they can also be mailed to you as well. I know that that's a common big thing that people have been using since the pandemic. So reading the label for over-the-counter meds. So what to look for is you want to look for the drug facts. This will tell you basically everything you need to know about the medication. That usually includes what it's for, how much of it, things like that. You'll also want to look at the time. So how many hours to repeat the dose. You'll see in this medication over here, this is actually for liquid Tylenol, and it's for toddlers. And it'll tell you how to give the medication, when to repeat it. So this one you're going to repeat every 4 hours with last symptom, or as long as the symptoms last. And you don't want to give your child this more than 5 times in 24 hours. So you can look over here at the dosing chart. This will tell you, especially for kids, once you get to adult medication, there isn't really a dosing chart because that doesn't play a factor in the medication that's given. They're usually a set number for all adults. So this will really consider weight, age, and then dose. So you'll see over here weight. If they're under 24 pounds or under 2 years old, you'll want to ask a doctor. If you are unsure of your child's weight, be sure to go by the age. So if they are under 2 years old, they should not be taking this medication. If they are 2 to 3 years old, they can take this medication. The dosing chart also tells you how much they need, and for this one, it's pretty simple. It'll just say 5 milliliters. Some other ones may have a bigger list where it has the age and weight, and it'll say 5 milliliters for this weight and age, 10 milliliters for this weight and age. So be sure to look at those things. If you're ever also confused about it, they do have numbers on the labels as well that you can call and ask questions to the Tylenol. It may not be very quick. Another option is also calling your doctor's office or your child's doctor office or even the pharmacy, they're always willing to help, especially if you know the medication they're taking, or even if you're in person at the pharmacy as well. Always feel free to ask questions because these labels can be a little bit confusing. So what to look for prescription labels: you want to look for times, dose, how long. And you're also, if you're ever confused, feel free to call your baby's doctor. They'll also have nurses on staff to answer those calls as well. And you can also ask your pharmacist questions. So if your baby's taking a new medicine, or you've never had to take antibiotics before, feel free to ask your doctor. And then this picture on the right over here has a really good demonstration of what each of those little things on the label means. I know it's a little bit harder when it's wrapped around the bottle, but this is a pretty generic label that you can look at that'll kind of describe pharmacy address, the number that you can call, the name. It'll also describe the refills at the bottom. But always feel free to ask your pharmacist questions if you have any questions about any medication, especially if your child is sick and doctor recommended to take 2 medications and one is over the counter and one's prescription. You can also ask the pharmacist when they recommend that they take those. That'll be really helpful. So measuring the medication. So measuring medication, there's 3 different common ways that their medication is measured for kids. Typically, it's always liquid medication. That's the easiest way to give it to a child. The first one is the syringe. So this is used to give medicines directly into the child's mouth. Also with the pacifier, these can also be used to put, as the child gets older, if they take their medication in chocolate milk or a juice box, this can be used to measure and then also put it in there as well. A dosing spoon is another way. So this is where they can actually drink their own medicine. They'll just kind of hold up the spoon, fill it with the medication, and then measure from there, as you can see in the picture. And then the last one is the measuring cup. This is used for children who can drink their medications and are less likely to spill. So typically older kiddos, when you're looking at like 3, 4, 5 years old, is when they can try to start taking their own medication and being a big kid or a big girl or a big boy. Always use the measuring tool that came with the medication. So when you buy infant Tylenol or toddler Tylenol, it'll always come with a little cup or possibly a little syringe. Always use those measuring instruments to measure the medications. Never use kitchen spoons or utensils to measure the medications because they can be pretty inaccurate, because most of the kitchen utensils aren't equipped for measuring for that small of milliliters, because when you actually see what 5 milliliters looks like, it is not very big. It's very, very small. All right, and then I'll link this video below just because I obviously can't show it on the YouTube. Feel free to look at this video. It's a great demonstration of how to measure the different bottle, or using different types of bottles, and then also measure with it just in a little cup as well, which is a great way to know how to measure with a spoon. All right, giving medication. So giving meds to a baby. So this is about newborn to 1 year old. You can have babies sit in your lap in an almost upright position. So you can see on the right over there, they're not completely flat on their back, but they're a little upright, kind of like when you're feeding them. You don't want them completely flat. It's more of a little angle. You want to give medicine right before feedings. This will really help try to keep the medication down, because if you give it towards the end, baby might be not hungry anymore and not want anything, so they might be more likely to spit it out. Let your infant suck the medicine out of the medicine syringe. I know there's also binkies that people use where they attach the syringe to the binky, or they cut off a little tip of the pacifier and then put medication into the binky, or nipple, or soother as they're called as well. You really don't want to squirt the medicine into the back of the baby's throat, because this may cause them to choke. So if you do need to squirt it a little bit, they'll recommend that you squirt it actually on the inside of their cheek. So when you're aiming, you're kind of aiming for the inside of their cheek and not the back of their throat, because this can cause them to choke. Some medicines can be mixed with foods or drinks, so make sure to always ask your doctor or pharmacist if they can be mixed, because this can actually be pretty helpful for giving them to children. Only mix medicine with foods that they don't have to have, so it's not something super important if that's okay. I know in the beginning it's difficult, they're only having breast milk, but make sure it's with a food option that's something that if they associate the medicine with it and they start not wanting to eat that food, that it's not going to be a big problem because they don't want to eat milk anymore and they have milk all the time. So try to mix it with different foods or have it be a food that if they end up not liking the food, it's okay, whether it be juice or something like that. Some medicines can also be put in a bottle or cup with a drink. Only put a small amount in the drink to be sure the child finishes the drink. So if you know they drink like half a bottle every meal, only fill it with like a quarter or even less, then mix the medicine in it and then have them drink it. This will kind of guarantee that they'll actually take the medicine. Because I've worked with kiddos before where they usually drink a full cup of chocolate milk and I mix it with the chocolate milk and then they only drink half the chocolate milk. So I don't know how much medication they actually ended up taking. So try to do a small amount because you can always give them more after. Yeah. So giving medicine to a child 1 year old or older, staying positive and making medicine time fun and an expectation will help encourage your child to take their medicine. There's different methods that you can have that I've listed on here. So giving the medicine straight from the medicine device, and you can use simple wording like first medicine, then breakfast, or first medicine, then bottle, or then juice. This will really help put into perspective like, oh, I have to do one thing, then I get another thing for the baby. If you make it too complex where you're saying, if you take your medicine, then you can have juice later because you were a good boy, that can make it really complicated for a child to understand. So sometimes just simplifying it to first medicine, then breakfast, and then showing them those two things, then they kind of understand. You can also ask your pharmacist if it can be mixed with food or drinks. Like I said before, this can help make it just a little bit easier for swallowing and eating. And if they don't like the taste of medicine, I've actually used this with a couple kiddos before when they've had some not so fun tasting ones. You can actually use a popsicle before to freeze the taste buds a little bit and then have them take the medicine, and it actually will taste just a little bit not as bad. It actually really helps out with the taste there. You can also mix it with soft foods to mask the taste. You can also always offer water or juice after to help wash out the taste of the medicine. This will help make it a little bit easier. Yeah. And then additional tips, staying positive and making it fun is the best way to go. You can also, once your child gets older, you can explain to them what their medication is for. So if they're sick, you can say, this is going to help your tummy feel better, or this is going to help your fever come down, little things like that, especially when your child's older. That'll really help put into perspective why they have to take the medication. And that can just kind of be a little difference for them. Like, oh, it's not something super annoying. It's going to make me feel better. You can also try to ignore your child's behaviors when they don't cooperate. I know that that's a different method for every parent, is either ignoring or whatever you choose to do in that moment, but that can also help because if you are giving medication in the morning, they could just be overtired or just waking up still, or if you're giving it late at night, same thing. So letting the behavior kind of pass might be the best way to go if your child's very tired or hangry. When possible, let your child use how and when to take their medication, or which medication to take first. So let them hold the spoon, let them hold the syringe, because it'll make them feel more in control of their situation, not that they're being forced to take this medication. Another thing is also if they have multiple medications to take, like if they have a Flintstones vitamin, or they have 3 different medications that they have to take for the strep throat they have right now, or something going on like that, you can actually give them the choice of, do you want to take this one first, or do you want to take this one first? And that actually can really help kids feel more in control and be, oh, okay. And then also another thing is praise your child when they do take their medication without struggle. It's important to really point that out, be like, you did a great job today taking your medicine. I'm so proud of you. And also you can find little motivation that's fun for them, whether that they love stickers. I've seen kids that love to color after they do their medications, or they just kind of get a free choice of what they want to do. So 5, tracking medications. So this is important for if you need to keep track of medications, because I know it can be pretty easy to forget. Like if one, like the Tylenol label we were reading, that one's every 4 hours. So it can be pretty easy to forget, oh, they take it 4 hours later, or if your partner or a friend is taking care of your child as well because you're at work or something, reminding them that it's been 4 hours to take it, that can be pretty hard to remember. So there's 2 main methods I've seen work pretty well. The first one is the paper medication tracker. So that is writing down when, how much medication was taken. You can bring it with you if necessary. It can also be hung up and stored where you give medications to your baby. So if you give medications in the bathroom, you can hang it up in the bathroom and then just write down when it's done. You can also take it with you or have certain medications that are written on there when that's more on the go. And that's an easy way to keep track of those things. Another way is with your phone. I know a lot of us have phones. So there's an app called the Huckleberry app, and this one I've kind of plugged before. It's great at tracking milestones, but it's also great at tracking medications, feedings, naps, and diapers for free. You can also use your alarm app. I've seen this used before. So in your regular normal phone, you can pull up the alarm app and kind of set it, and you can have it set for every day. You can also set reminders too, but it's just those little things because medications tracking can be pretty hard to remember. So here's more examples of the paper tracking that I have linked down below. So if you would like these printed, just reach out to your caseworker or otherwise having them printed. They're all available for free download. So just click on those links. The baby care journal kind of covers more. So all of the baby things, so covering feedings, naps, medications, diapers, and there's also tips on the other side as well. Medication tracker. So this is more just for medication. You can even use this for yourself. It goes through the week and it has morning, afternoon, evening, and then other extra medication sections as well. And you just mark off when they were taken. You can also use this to write down the specific time that you need to take them, if you remembered to take them, and then writing little notes at the bottom as well if you forgot to take one or what happened. Tracking with the app. So this is the Huckleberry app I was talking about before. So to find the app, just search Huckleberry in your phone's app store and look for the picture above. It just looks like a little berry. So in the app, you can actually download, I'll have the 2 links below for the Android and iPhone version. There are paid services, but it is free to track the medication, sleep, activities, temperature, feedings, diapers, a whole bunch of things. And you can also set reminders, which is really nice. And you can also get rid of those reminders. So there's a screenshot of the app over there, and I'll link other resources for this app below. And then the good old-fashioned way on your phone is also the alarm clock app. I've seen this used by many parents, especially if it's short-term over-the-counter medication. You just set an alarm in your phone's alarm section, and sometimes it lets you label it as well, but it's more so just for you to remember that time. So when the alarm goes off, you know to give your child medication as well. So common questions. So these are the most common questions I've seen come up. What if my child spits up or throws up the medicine? Call your doctor for further instructions. Also keep track of when the medication was taken, when they spit up or threw up, and then what it looked like. Because if the medication, I know there's like certain antibiotics that are bright pink. So if your child throws up and it's all pink and you call your doctor and say they threw up 5 minutes after, their recommendation may be to give them a second dose. But that's all up to your doctor and asking those questions. You can also call the pharmacist as well. They might have some information. Also, what if my child doesn't want to take medication? Some kids prefer the medicine chilled, so you can also talk to your pharmacist and see if you can put it in the refrigerator. That can actually help with the taste buds as well, making it taste a little bit better because it's a cooled off medication than just kind of sitting out warm. Pharmacies also have different flavors you can add to the medicine and make it taste better, so you can also look into seeing if that can be added as well. If it is okay that the medication can be mixed with applesauce, ice cream, pudding to mask the taste as well, ask those questions to your doctor. Those can also be very helpful. Rewards such as sticker and candy can also help encourage your child. I more so recommend the sticker side or coloring or something that's not food related, but that can go as well. And then also 2 reminders here. Remember to never call medication candy. This can backfire, and I've actually seen it backfire where a kid will, he took vitamins saying that they were candy. So that was an interesting story to hear from their parents. So never call medication candy because then they will think it's candy and they will eat it. This also can lead to children trying to take medication they're not supposed to because they'll think it's candy. So, yeah. Well, thank you for listening. I'll have a survey below if you want to fill that out as well with any feedback that you have on these videos or classes. Feel free to leave comments at the bottom as well and check out the links below. Thank you.